Hi everyone. So my case study. Mark is a 30-year-old father of two, works full-time as an electrician. He and his wife have been raising their 8-year-old daughter Layla and 5-year-old son, Malik. Marcus is known for being dependable and emotionally stable. He's never sought counseling before and usually believes in handling things on his own. 3 weeks ago, Layla, his daughter, was diagnosed with a type of childhood cancer. The diagnosis came suddenly after what Marcus thought was a minor flu. The doctors explained that Layla would need immediate treatment, including chemotherapy and possibly long-term hospitalization. Marcus cycles between shock, denial, and deep sadness. He cries in private but suppresses emotions around his family to try to stay strong because he is the man. He feels guilty for not noticing Layla's symptoms earlier and feels angry that life is unfair. Like, why is his daughter going through this? So, background on situational crisis. Marcus is experiencing a situational crisis pertaining to his daughter's Layla illness. Situational crisis is a brief 4 to 6 weeks period where the person has a non-illness subjective reaction when confronted with an unanticipated, traumatic, and uncontrollable situation and has difficulty resolving the threatening situation using the individual's usual problem-solving strategies. And this comes from a journal that I reference, Fathers in Situational Crisis. Okay, where am I at? A situational crisis, and this is also referenced from it. A situational crisis can occur within a hospital setting, an environment unfamiliar to most people, and where there are few support structures for the family of the ill child. Empirical evidence suggests that a child's hospitalization might be a major crisis in the life of the father, especially if it involves admission to a pediatric intensive care unit. Cool. Now so that was the background on situational crisis. Now let's go to the healing process. Having Marcus as a client, it will be important to build trust and rapport, as this is a difficult time for him. To ease the tension, I will want to introduce the technique of broaching, seeing that he is coming to a woman for counseling. I would like to address the opposite genders in the first counseling session to create the atmosphere of trust. I would approach the broaching technique something like this. As the father, you are the protector and the provider of the household. I can't imagine how you feel at this moment. There have been countless studies on women in this predicament, but tell me how it feels from the lens of a father. Hearing his point of view from a father's perspective will be important to create mutual empathy. I will let him know that it's perfectly okay and normal to show emotions and feelings during this time, and it doesn't take away from him being a man. I will let him know that all the emotions he is feeling are normal going through a crisis, but I am here to help him through the pain. Once we build trust in a therapeutic relationship, I will want to dive into how this crisis event impacted the dynamic of the family household to implement a new course of action. For example, Marcus will need time off of work, and if his job doesn't pay for the leave, it will be my duty to link him with resources that will help. If insurance does not cover the expenses of the treatment, I will help to find organizations and resources to lessen the burden in already hard times. As counselors, we stay abreast of community resources and network with partners in the community who offer specialized services. And this is quoted from the book. This is a reference from the book. It is important to foster connection with others. Therefore, linking Marcus with a support group for men going through the same situational crisis will help lessen the feeling of isolation. So it's important to find a community group for him, for fathers that's going through the same thing. Psychoeducation will be important around this time. Getting Marcus familiar with the hospital setting, the procedures and equipment that will be used will be important. The foreign hospital environment with the strange routines, the variety of healthcare providers, and strange medical procedures and equipment constitute a great source of anxiety for fathers. We will want to communicate with staff at the hospital to make sure there is a direct line of communication and understanding of the process and what the family should know. Direct communication can help ease anxiety and distress the family might have. We will need to come up with a plan on how daily activities will be altered and healthy coping strategies to deal with the situational crisis. I want to set up routine sessions to make sure Marcus achieves growth. And I will want to plan bi-weekly meetings. If we need to do weekly, that's perfectly fine. But just to start with bi-weekly so he doesn't feel overwhelmed. And that's what I have for this post. Thank you for listening and thank you for watching.